It's a really exciting time in history. In 2025, the World Health Assembly passed a resolution for the first time on skin disease as a global public health priority.
And a resolution is a formal agreement made by the member states, 190 or so of those who govern the WHO. And it's an international political instrument which provides advice and a framework to allow countries to gather around that and align their policies and their strategy to address global health, public health issues. And the resolution itself was brought forward by a number of countries, led by Côte d'Ivoire. And the resolution is a fantastic resolution in that it addresses a number of issues. One of the key focuses is on expanding capacity and provision of health services which will address dermatology or skin health, recognising that skin disease services are essential for achieving universal health coverage. This will include increasing training of frontline healthcare workers, as well as recruiting and using the internationally available WHO collaborating centres. It also reflects that we don't have adequate diagnostic tools and is encouraging investment in those to include particularly a focus with digital health, so thinking about things like teledermatology. It's also recommending that skin disease is measured properly, so data is collected so that we can understand the true burden of skin disease. It is really exciting from that point of view. It's encouraging increased surveillance of skin disease. It's encouraging research prioritisation. It also recognises that skin disease is stigmatising and that policies should address that. So it has instructions and recommendations for member states. It has instructions and recommendations for the wider community around dermatology, and it also has recommendations for the WHO itself. So up until now, the ILDS, by its official relations status, has been providing technical know-how to the WHO. But with this resolution, the WHO has been tasked with developing some sort of leadership structure and function for skin disease and common skin disease, which is really exciting.
And I think overall what this resolution does is it really opens a door to discuss with governments, ministries of health, or other stakeholders like other NGOs, including us here at the International League of Derm Societies, to really work towards skin health for all. There are over 4.6 billion people living with skin disease around the world, and we know that approximately only half of them have access to the healthcare that they need and that they deserve, which means that right now this healthcare is acting much more like a privilege than the human right that we know it to be. If you look in different countries in sub-Saharan Africa, there are only between 0 and 3 dermatologists per million people, which is really hard to comprehend, 1 dermatologist per million population. The numbers are really similar in other areas of the world, for example, in the remote Pacific Island nations, where there are also very few and often no dermatologists at all. So we really have a critical role to play in terms of access to healthcare. Now, we know there will never be enough dermatologists to fill that gap. So in addition to training more dermatologists at places like the Regional Dermatology Training Center in Moshi, Tanzania, or the Pacific Dermatology Training Center in Fiji, we know that we also have to think about upskilling our frontline healthcare workers and community healthcare workers around the world to fill those gaps in terms of access to care for skin health. By understanding really our disease burden, and for example, what are the top 10 diseases in each particular country, which will vary by country and vary by region, we're really going to be able to target our training to really make it appropriate for that particular population and country.
Implementation has begun because we have permission with the passing of the resolution to be able to go and talk to our ministers of health with any initiatives we think that align with the resolution recommendations to improve skin health for the world.
So what does success look like for us for the World Health Assembly resolution on skin disease when we think about the short-term and the long-term goals? And what this really means is increased access to skin health for people affected by skin disease worldwide. And this takes a lot of different pieces and a lot of different components. We have increased access to training, we have increased access to essential medications, improved diagnostic services, and also, importantly, reductions in stigma, which we know are so closely associated with skin disease. So really looking at this from the big picture, we're looking at increased access to care for our patients and really with our patients. This is something that's co-developed with patient groups and supported by patient groups around the world.
Now the resolution has passed, we can expect to see changes immediately. There's nothing to stop member states implementing the resolution recommendations right now. Fiji have been very encouraging already with their Permanent Secretary for Health incorporating an increased prioritisation and excitement around skin health, particularly as they go forward to their regional WHA meeting in the Pacific Island Nation region. Some of the other changes will take longer, and we look forward to those, and we will work with all of the member states that want us to come alongside with them. And by we, I mean not just member states, not just the WHO, not just the International League of Dermatological Societies, but the wider stakeholder community who are interested and invested in skin health for the world. We include patients within that. Most importantly, their voices are vital to inform us, to encourage us, to keep us focused on what really matters, that we improve patient care, improve skin health, and improve the lives of those with skin disease around the world.